Bonjour. I am starting really with a bonjour. It's really lovely to see all the familiar and less familiar faces of. I'm seeing some students, a lot of colleagues. It's really really lovely to see. So, bienvenue à tous. Hello to everyone. Good afternoon. My name is Véronique Pepin. I'm the interim dean of Concordia University School of Health. I know I've met many of you, but I'm seeing also a few new faces. So really welcome to this afternoon's activity. Before we get started, I'd like to begin by acknowledging that Concordia University is located on unceded Indigenous lands. The Kanien'kehá:ka Nation is recognized as the custodians of the lands and water on which we gather today. Tiohtià:ke, Montréal, is historically known as a gathering place for many First Nations. Today, it is home to a diverse population of Indigenous and other peoples. We respect the continued connection with the past, present, and future in our ongoing relationships with Indigenous and other peoples within the Montreal community. It's now my great pleasure to welcome you all today to a very special edition of the School of Health Colloquium series. I'm delighted to introduce our speaker, Dr. Tim Evans, Concordia's Vice President of Research, Innovation, and Impact. Le Dr. Evans apporte une expérience et un leadership extraordinaire dans le domaine de la santé mondiale. Il a obtenu son diplôme de médecine à l'Université McMaster et un doctorat en économie agricole à l'Université d'Oxford en tant que boursier Rhodes. Tout au long de sa carrière, le Dr. Evans a été à l'avant-garde d'initiatives transformatrices dans le domaine de la santé. Il a occupé des postes de direction clés à l'Organisation mondiale de la santé, à la Banque mondiale et à l'Université Bra. Il a également été directeur exécutif du groupe de travail canadien sur l'immunité contre le virus COVID-19, jouant un rôle crucial dans notre réponse nationale à la pandémie. Prior to joining Concordia, Dr. Evans was the inaugural director and associate dean of the School of Population and Global Health at McGill University, where he also served as associate vice president of global policy and innovation. He's been instrumental in shaping global health policy through initiatives such as the WHO Commission on Social Determinants of Health. His efforts have also significantly improved access to HIV treatment and midwifery training in Bangladesh, underscoring his lifelong commitment to health equity. We're incredibly fortunate to have Dr. Evans here with us today to share his insights in a talk titled The Opportunity of a New School of Health at Concordia, Carpe Diem. Nous avons la chance inouïe que le Dr. Evans soit parmi nous aujourd'hui pour nous faire part de ses réflexions sur l'opportunité d'une nouvelle école de la santé à Concordia. This is a momentous time for our school, and I can think of no better moment for us to reflect on the opportunities ahead and how we can seize them to make a lasting impact. Please join me in giving a warm welcome to Dr. Tim Evans.
Merci beaucoup, Véronique. Merci à tous et à toutes pour être venus aujourd'hui. Thanks everybody for coming on a Monday. It's a tough day, especially when it's cold, and I'm normally heading home at this time. So great to see you all here. So yes, thank you for that nice introduction. I'm going to get right down to this. I'm going to chat for about 25-30 minutes, and I hope that will stimulate further conversation on what I think is this extremely exciting project. So I'll talk a little bit about the health context, because I think any institutional enterprise that we undertake needs to be responsive to the context in which we're living, not only now, but prospectively. And then I will talk and focus in on the academic health institutional context, because we are part of a much larger set of academic health institutions that need to position themselves strategically. And I will give a sense of what I think could be a very complementary entry point for Concordia as a school of health in that context, with a niche and a vision that it's building on strengths, it's not starting from scratch, that it will address its core academic functions like any institution in partnership. So the context. Some people refer to the current context as a polycrisis. The glass is less than half full. these are some of the changes that are taking us all a little bit by surprise because they're accelerating. They are not linear. They are not a constant velocity of change. They are accelerating. Climate change, pandemic threats, food security, population mobility, often not voluntary, but sometimes voluntary, forced displacement, rapid demographic change, aging, of which I'm unfortunately part, and multimorbidity or comorbidity. And we find very, very high rates of not just one disease, but multiple diseases amongst the older population. And that's very tough to manage. Political polarization, you only have to look at CNN to see that. Authoritarianism, systemic inequalities, and then we're into this new brave world of generative AI without guardrails. So those are some of the things that raise governance challenges locally and globally, including in health. And that's really not straightforward. However, those who see the glass half full may say, we've never had greater opportunity. So global pharma, we broke all records in the development of a new vaccine for COVID, less than a year, never been done before. And the pharma industry believes we can do faster, better, cheaper drugs and vaccines for markets of 8 billion. That's the world's entire population at the moment. Precision health, the idea that we can really tailor things through either therapies or understand your own health conditions through wearables, imaging, and even drone delivery systems that take things off of wheels and actually put them in the sky. In Rwanda, they're delivering blood to clinics, dropping it 3 feet outside the clinic, and they don't need any land-based delivery system anymore. Social prescription, this recognition that there's lots that can be done outside the healthcare space, and which is transformative in terms of NCD prevention, dealing with mental illness, as well as loneliness. Green tech, lots of progress being done in decarbonization, clean air, drought-resistant crops, digital health, hospitals at home, algorithms to predict risk and tailor care to specific individuals, and systems design. Framework conventions for tobacco, maybe alcohol, maybe even ultra-processed foods, if Kennedy is in fact approved for the DHHS post, and then win-win migration plans for health workers. So I present that because sometimes we see everything as negative, and there are many who are, in some respects, especially in universities where you're discovering things, optimistic that crisis is opportunity. One of the things I like to say in the context of health is things look very much the same no matter where you are. And that's based on my own experience where I've been on every continent, almost every country. And when I talk to health ministers or people responsible for the governance of health systems, they all sound remarkably similar, no matter how wealthy or how poor they are. They have all huge problems with inequities. They can't get opportunities to the people who need them most. Huge problems with inefficiencies. The more they spend, the faster spending goes up, with almost no accountability and a huge amount of inefficiency everywhere, including in our own backyard here. Insecurity. The idea that emergencies now happen regularly have revealed huge gaps in our preparedness and our response capacity. Impatience. The providers, patients, and public are really getting frustrated because their needs and demands are consistently not being met, and there's growing distrust in the system. Then finally, interdependence. No health system is an island. whether it's infections or new technologies, health workers, the environment, all of these things cross borders and make health systems complex things to manage. So I like to talk about what I call the brave new world of global health. Because I think when you bring all these things together, they aren't things that you can say, oh, we'll only deal with this, because they're all amongst us. And I put them into these four categories: pandemics, syndemics, and climate change. And those are the things that are uncertain. They move quickly, they surprise you, and all of a sudden you have no choice, but you have to react. Systemic inequalities, more chronic, and you see them across all sorts of social strata. If you don't deal with them, you know that when you have a crisis of one form or another, those individuals will be disproportionately affected. Systems performance shortfalls. All health systems have difficulties with coverage, quality, affordability, their speed and surge capability, sustainability, expectations, and trust. And we have the brave new world of health tech and digital futures, which anything that ends with an emic or an omic, then that's a good one. AIs and apps, precision and personalized care, myths and disinfodemics, all sorts of challenges on those fronts. And then when we look forward, it's going to get even tougher. We've got cost pressures from chronic disease, aging, new technologies that we can't all afford. We have fiscal stagnation, especially right now at all levels of government. That's being pushed by aging and this switch to gig economies and the informal workforce, which takes coverage away from folks. Economic shocks, which we've seen recently, and then these inequalities. So sometimes when I do a talk, which is global, and say this applies to every, people say, well, this isn't Canada. Well, it is. So we have a primary care crisis in Canada, despite the fact that a 1 unit increase in primary care results in an average decrease in mortality of 49 per 1,000 people, 100,000 people. 25% of eligible Canadian residents do not have regular primary care providers. We have rapid population aging. This is data from British Columbia on the left, which shows in the light green bars how the insurance age distribution is moving to older age groups quite quickly. And then on the right side of the graph, you see in the pale blue bars the numbers of those individuals that have comorbidities or multimorbidities. And you can see that as you move into the 80+ group, it's 3/5 of the population. And for anybody who's taken care of people, a second or a third condition is not additional in terms of complexity. It's more likely exponential. All of this puts a huge burden on the health workforce, and everyone's complaining that they're working harder. They're feeling less supported, more burnt out. And many are thinking about stepping away from their jobs, given that they've got good pensions. So when we lose health workforce in Montreal, Quebec, Canada, what do? We recruit from outside because we don't have enough training internally to bridge the gaps. And so we do this across provinces, PEI here, or a piece in the New York Times a couple of years ago, which showed how we're really trying to poach nurses, which is fueling shortages in other countries. And this is a nice piece looking at the implications of our poaching of nurses. And the reason I put this up is what we do in our health system has an impact on other health systems, right? And this is part of the interdependence that we have to develop competencies to manage moving forward. So how do academic health institutions contribute in this brave new world of global health? So let's go to a little bit of history, because I like to go back before I go forward, at least 2 steps. So in the 1800s in Britain, the port communities had very, 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 very high mortality rates, in part because of the working conditions of the laboring poor. And Sir Edwin Chadwick, in his report on the sanitary condition of the laboring population, identified these huge inequalities in survival and in living conditions for the laboring poor in the port cities, and recommended for the general means necessary to prevent disease, it would be good economy to appoint a district medical officer independent of private practice with the securities of special qualifications and responsibilities to initiate sanitary measures and reclaim the execution of the law. It's quite loquacious, isn't it? So this was really the first descriptor of a public health officer. And this is actually what led to formal academic training in public health. Up until that time, it had been mostly related to what was then called medical training. In the early 20th century, we got the Flexner, Welch, Rose, and Goldmark reports, and there are supposed to be 3 faceplates to those reports. The Flexner report was the prescription for medical education, taking it out of quackery and giving it a discipline-based approach to training. Welch Rose was the template for public health training, and the Goldmark report was for nursing. So that all happened over 100 years ago, and virtually every school of medicine, public health, and nursing reflects what was recommended in those reports 100 years ago. Not a whole lot has changed. Some has changed, but they were very important. However, in 2010, a century later, I had the opportunity to be part of this commission, Health Professionals for a New Century. And we said, oh, we've got to rethink Flexner, right? Because the world has changed. And so we put forward a vision of transforming education and education institutions to strengthen health systems in an interdependent world. So that was back in 2010. We thought, well, this will modernize the whole academic health institution approach to addressing health problems in the 21st century. Others moved in this direction as well. Victor Zhao and colleagues published in the same year on the role of academic health science systems. And the reason I put this slide up is if you look at the spectrum of areas that are deemed critical to academic health science systems, they cover the entire span of the university. They are not limited to the medical school. And this is coming from somebody who is the president of the Institute of Medicine in the United States. He's saying we really need a university approach to address health challenges. So what's actually happening at the moment? Because many of you may be aware that the academic health institution landscape in Canada is not sitting still, especially in the context of a crisis. There's much more money and infrastructure for existing research priorities that is largely based around tertiary care settings, hospitals. Okay, that's where the lion's share of research is done in wet labs. Okay, more collaboration in research, which is very positive. Canada's been a leader on this. There's the SPORE partnerships, recognitions of engaging communities and global networks. We have new schools, new nominal schools, not different types of schools, but we've got more medical schools now, even one in Cape Breton and PEI. We have more nursing, public health, and pharmacy schools. Class sizes are increasing and enrollment is changing to reflect population diversity increasingly. Long way to go, but moving in the right direction. So there's stuff happening, right? So in that landscape, where is it that Concordia might find a niche? And it's not only the landscape, it's also thinking about the bigger global health context that I outlined earlier. So the first thing is, where do you not want to go? And I think Concordia's School of Health is not a clinical school, be it medicine, nursing, social work, occupational or physical therapy. There are lots of those schools. And if you try and get in on that front, it's not easy. Just ask Université de Québec à Montréal. They tried to break in, but they got pushed back by the Gang of Four recently, right? Not easy to gain entry. Nor are we a school of public or population health. There are lots of those schools around as well. And we don't have a big biostats epi department, which is often seen as the foundation for getting in on that front. And nor is it a silo that has zero-sum relations with other faculties in the university, because the school was born as a virtual school across the 4 faculties of the university. So it is of the university. It is not a separate silo. Hugely important. So that's what it's not. So what should it be? Okay, and so these are my 2 cents on what I think it should be. First, we do have a growing crisis in value in healthcare. When I say value, it's not by any means limited to monetary value. It's value in terms of what we value in health, right? Better management, better access to care, more responsibility, responsiveness, dignity, fair opportunities, fairness. Value has multiple dimensions. And Teesberg and Porter wrote very convincingly about the penury of efforts to create value in health, despite huge amounts of expenditure. And then a Canadian by the name of Thomas Homer Dixon, who some of you may know, wrote about 25 years ago about how in the context of the environment, we are creating problems much faster than they can be solved. And he referred to this as an ingenuity gap. And as a student of Dixon, Homer Dixon, I would say what he wrote in the environment, you can remove the word environment and put the health sector in every place, and you see the same form of ingenuity gap. And this is unsettling because there is this sense that we're creating more problems faster than we can solve them. And the question then is, how do you diminish that gap in ingenuity? It's not limited to the health sector, but it's certainly relevant to the health sector. So this comes to the last part of the diagnosis made in the commission that I participated in 2010, where we noticed when we looked across health professional training institutions that there's a certain type of competency that you almost never encounter. And it's what we call transformative competencies. And transformative competencies are ones that allow individuals not simply to be informative technicians or have the right values, but know how to lead and how to navigate and lead change. And I've just lost le fil. Oh, I'm back. Did you do something or did I? Or did somebody up there? All right, great. Oh, it's the projector. All right, so transformative competence means when you look and see what part of the medical curriculum teaches doctors how to navigate and lead change. 0. Great on teaching them on how to take care of patients. Public health, right? You'll learn how to do logistic regression or understand environmental risk or attributable risk, but you will not get any formal tuition in thinking about how you change the behavior of the system overall. Okay? So this was one of the assessments. Of course, what we were recommending is there needed to be more done. The problem is when you try to do anything with well-established curricula, there's no room for change. oh, we'll put that on as an elective. That'll be an add-on along with a couple of other things, as long as nothing else changes, right? And that, I can say, is something I've encountered in multiple settings, which is you can change the curriculum by adding something on, just don't touch anything else because it's perfect, right? So where we're finding a major shortfall in the health professional education institution landscape is the failure to generate the knowledge and know-how needed to tackle the challenges and harness the opportunities of health in the 21st century. Okay? We're not doing that as systematically as we could be. And that, I believe, could be the complementary niche of the School of Health at Concordia. It focuses on adding value to health. And we can debate and look at what constitutes value. Because if you can't do that, it's not sure, you're not clear what you need to do or what you can do or what you are doing. Secondly, we need to think about how to bridge that ingenuity gap, right? That is tough because not only do we need more problem solvers, we've got to keep up with the rate of change. And third, we've got to nurture transformative competencies much more systematically, such that we might say that the School of Concordia of Health, School of Health at Concordia is all about knowledge and know-how to tackle the challenges and harness the opportunities of health in the 21st century. It generates intrepid solutions that harness new technologies, span sectors, bridge disciplines, cross borders, and engage diverse partners. Okay? And that is relatively unique in terms of defining of schools of health. So this isn't competition to the medical schools or the schools of nursing or the schools of public health. This, they might say, okay, we might like to collaborate with you. We could see this potentially as a complement. So this brings me to where I think is one of the greatest opportunities. Whoever had the foresight to think about the School of Health as university-wide, they deserve huge kudos because in my experience, I have never seen a School of Health that is truly university-wide anywhere. Huge, huge opportunity because first, you can think about the distinct spaces where value can be added in health. And I like to put this up because it's not all the same. Okay, I have 3 Ps. I like alliterations. The first is promotion. When you promote health, you don't necessarily need a hospital, right? You need a community, you need a household, you need education, you need clean water, you need clean air. These are all things that lie outside the formal health sector. And there's already lots of stuff going on here on that front. But if you could promote health in such a way that exposure to particulate matter went down by 2 log orders, you could decrease rates of cancer in the next generation by huge percentages, knowing what we know now, right? But the issue is not creating new cancer treatment. The issue is changing the environmental standards for emissions or decarbonizing, right? So those things have huge value. And you realize that value in a space that has nothing to do with hospitals. This is social space, not well understood by the mainstream of health, but absolutely critical to health. Second, provision. This is more bread and butter care as you think about it through somebody with a stethoscope, a bed, and a facility. It's huge. Okay, there's a $10 trillion healthcare economy. Half of it is in the United States. Nevertheless, it's growing very rapidly. And so there's all sorts of opportunity to add value in the area of provision of services, healthcare services. And the last area, which has been really brought to our attention in the context of the pandemic is the area of protection. And this relates to the calamities that we can't predict in advance, but which we know are going to happen, right? Bird flu is absolutely simmering south of the border right now. We don't even know how bad it is because they've decided not to report on anything like that anymore. But the issue is the circumstances in which you respond in an emergency are vastly different than providing care in peacetime or promoting health through social assets, right? So when we think about solution spaces, it's not a one size fits all. And if you're entrepreneurial, you'd say, hey, those are three great areas, very different, where there's opportunities to do some good, right? So we need to complement that, which is what are the engines of innovation, the expertise streams that a school of health would need to harness. And this is not an exhaustive list, but it's reasonably complete, right? Biopharma, R&D, new drugs, vaccines, pretty clear. Bioengineering and medtech, wearables, imaging devices, massively important growing area. Social and behavioral change, again, really exciting area of knowledge generation. It isn't like Nike says, just do it. Behavior is determined by all sorts of factors that we really need to understand if we're going to be serious. Green tech has huge implications on health, and the healthcare sector is one of the greatest greenhouse emission contributors. Digital health and AI, it's everywhere, cross cuts all of these other areas as well. And it's changing the way we think, the way we learn, the way we act. And finally, complex systems design. And this is the recognition that, in fact, you can change the way the system is set up and the way it's structured and how you engage people in solutions. So these are areas where I call them innovation expertise streams because they can help in harnessing value for those solutions like this in a matrix. So you bring these three discrete areas of solution areas and you cross-cut them with these innovation expertise streams, and you've got a matrix of 15 cells in which you can define your activities of a school. And some, you'll see, will cluster in certain spaces. So from endogenous assets, existing assets, what I understand, Concordia's School of Health is going to be probably a little stronger on the promotion side to start. And not too bad in provision, maybe a little bit less present in the protection area. And then you may see different coverage across some of these areas of expertise. But we'll be drawing, because it's university-wide, on established assets. So like a lot of new schools, you don't have the problem of, well, we're starting from nothing. No. Faculty of Arts and Science, I have not put in any formal names to identify anyone because I'm too new. I would misrepresent you or I'd forget people. But some of the areas that I know are going on, which are really important, genomics, synthetic biology, behavior, aging, exercise, indigenous engagement, right? Faculty of Arts and Science, FOFA, music, art, drama therapy. Oh my God, they are on the cutting edge in the world on that front. GCS, Cody School, Green Cities, Decarbonization, Bioengineering, Bioinformatics, and the John Molson School of Business, Financing, Management, Entrepreneurship. So those faculties, if you look across them, already give the school huge value, right? Just because they're there and can do more in health. Similarly, you can up the game through research excellence funds, the set of research centers and institutes that are already working in the university A lot of them are very, very helpful on the health front, or could be even more helpful. And then the collaborative spaces. And I say that very deliberately because collaborative space is critical to bring folks together. Okay, so even though it's a virtual school, having real space in real places, which fosters that convergence, is absolutely critical. So this is my own very partial initial mapping. I've put in a few of the faculties by their acronym. I've also put in D3 because that's District 3, that's an incubator. And I've given you a sense of a very partial and initial mapping around these solution areas and expertise streams. And I think the take home here is you can see it clusters towards the upper left, right? And there's a little bit, lack of not much action going on in the protection. So why is this helpful? First, it says these are real strengths that the school has already up here. And you can harness those and build on those immediately. But you might also say, actually, we'd like to do some more in areas where we're not represented, but which are growing problems. And that's a room, an opportunity for growth. So you do that through amplifying these assets through their health impact, or amplifying their health impact through the traditional tools of an academic health institution, education. So new programs that focus on transformative competencies. There's almost no deliberate programs on transformative competencies in health. Concordia gets into that space now. It's going to have a big market, tapping new students at markets. Given where we are in demographics, there's a huge group of folks who I wish were sort of my age. They're the 35 to 55 group. I might align close, but I can't quite with the 55-year-old group. But they may want to do a second career degree. They may be already health professionals. They have been working for 15, 20 years. They're a little burnt out. They're saying, I need to redirect my career, and I want to do it with transformative competencies. I've got ideas. I know what the problems in the system are, but I need some help navigating that change. So we could be the go-to place for that. And doing it harnessing 21st century pedagogic methods and technologies. We are on the cusp, and already we saw in COVID, we switched to virtual much faster than anybody. We flipped classrooms. We think about experiential learning. There are all sorts of ways of packaging education in such a way that it responds more to, one, efficiency in terms of what we want to achieve, but also accommodates the demands of students. Research. We need to think about the full spectrum of research, right? And I'm Vice President, Research, Innovation, and Impact. Okay, that was a very deliberate strategic change at the university. So it's not just discovery, it's translation to development, right? Where you test a product or an intervention to see if it works, and then get it into the system to deliver and see, in fact, if it generates impact. And if that becomes the culture of research, then the appetite isn't simply going to start at the finish at the Nature article when you discover something. It's going to continue until you see system level impact. Helping that is our translational resources, some of which already exist. Incubation is D3's defining culture. It could do much more in health. It's already very active, but also acceleration and key infrastructures would be important to bring. And then very importantly, complementary partnerships with key research partners through things like living labs. And this is really important if you're out in the community, working with difficult communities that have been marginalized and have been ignored. You need to be with them learning with them, co-creating, understanding, and listening to their circumstances in such a way that whatever you're going to generate or co-create actually has meaning and can get picked up. Third area is service and partnerships, working with diverse partners. As I've been thinking about the School of Health in the last couple of weeks, I've made a few phone calls to universities that are active in health, but don't have any medical school or school of public health to speak of. And they're nonetheless bringing their engineers and folks in their arts and science, political scientists and others to address health issues because their faculty are interested. And when they talk to local partners of different stripes, the different partners are delighted that they're interested in their problems. So there's no pushback because they don't have some imprimatur of a medical school behind them, right? They're getting lots of great things, and just the same way we already have great linkages with the CIUS. Santé Québec is lots and lots of work there and great opportunities, but also potentially partnering with other academic health centers who want to join us in this mission in a complementary way. So those are just a few initial thoughts. And I really wanted to get those out to foster more conversation on this. And I say that with incredible humility because I'm just started my 6th week here. I'm learning a lot about the Concordia landscape, and it's fantastic. I mean, not just because I'm here, the opportunity I have with this School of Health is unparalleled, right? But as a rookie, I'm still, head partially in the sand and need to listen and learn, and would love to hear your thoughts and suggestions on how we can move forward. Thank you.
Okay, thank you so much. That was a fantastic talk. So we're going to open it up for questions. I'll take the questions from the room here, and we'll take questions as well from the Zoom. So feel free to come up. We've got plenty of chances to interact with Dr. Evans. So now the floor is open to you. First person to break the ice. There we go. Malcolm.
Hi, that was a very interesting talk. But you mentioned previously that sometimes it was hard to change direction because people would just add something on and it wouldn't really change the culture. It would just be hung out there. So how do you see making sure that people take the opportunity to join this? And is there much opportunity to sort of start bringing in new people around that vision?
Yeah. So first of all, great question, and thank you. I think there is, and I go back to the definition of the school as being virtually defined. It has to work with those that are already here in order to move anything forward, right? And there's a lot, as I said, and I'm sure you agree, there's a lot of assets across the institution. So to me, then, if you as a faculty leader have a vision on how you can bring assets together or work with partners in new ways, which could either be through research or some new living lab or some other type of mechanism, the school should be saying, how can we support you, right? And then looking at ways in which we can support you. So, I had a discussion with the dean and the assistants earlier today, but one of the things we said, like, if we're really ambitious on education, right, and we need to be, because we have to generate revenue, we might try and develop an education development unit. where you take the onus on the faculty member who's already 160%, stretched out and has no spare time. And you say, okay, you give ideas and guidance, but there's a really crack group that are fantastic on curriculum development, on pedagogic techniques, and you can access them with a view to getting this program up and through the hoops at, a third of the time it would take if it was left to you. So putting together some assets that could help get the core functions of the school moving faster are some of the things we're looking at, which might help.
Excellent. I guess we're going to have some time on Friday to talk about those points. So that'll be good.
Terrific. I look forward to that.
All right, thank you. We have a question on Zoom. Yeah.
Yes, we have a question in the chat or maybe to comment. So Canada is well known for pilot projects in health. What is missing is the opportunity for these success pilots to be scaled and spread. The School of Health could serve that important role with its university-wide approach. You might be onto something here. I don't know if you want to add to that.
Well, it's a great comment. And I think scale and spread is about impact. And I think, the problem of pilotitis is widespread. It's easy to be a little bit cavalier about that. Having competencies to take good ideas and translate them is all about what transformative competencies are. And again, I made reference to Nike's little just do it type of thing, which oversimplifies reality, I think, in a negative way or an unhelpful way. Because when we chat, and I've been doing this for a while, chat with people about, okay, is it all nature that you change the system, or was there some dimension of nurture, right? That age-old question. All those who've actually made change have said nurture is hugely important, right? They don't take away the sense that having some fire in the belly is important, right? But you can learn a lot of competencies from very hard skills, like reading a profit loss sheet or understanding budgets or business plans, to softer things like how do you manage partnerships, to more metaphysical things is like, where is there real value that is worth coalescing around? That is really tough question to answer. But if you get closer to what constitutes real value, then you may be much more successful in the scale and spread, right? So these are some of the things where the school would try and shine some more light on these competencies as complementary to the depth expertise, not substitution, right? And so you get this sort of this T approach to education where you've got depth with horizontal breadth, right? And so I think that's what the school is trying to bring into to stronger focus. Over here.
Do you want to come to the mic, Virginia, for Zoom? Folks on Zoom. Oh, Natalie, sorry.
Okay. Hi, welcome to Concordia.
Thank you.
My name's Natalie Phillips. I'm in the Department of Psychology, and my area is broadly aging and dementia. So, we're in a tough time, as you know. You've got a huge budgetary crisis. So I'm interested in your reflections on what we can do to support the researchers here. So you gave one very interesting example about educational program development and support in that area. But with respect to the researchers who are here, what are your reflections at this point on how to support the research capacity that's here and to grow it when we have quite a significant budgetary pressure right now.
Great. Well, great question and thanks. And the short and simple answer is I don't really know. Meaning there's a lot to learn on that front, but a few ideas at this point in time. First is be ambitious. And if I look at the fact that Concordia's research activities have grown by about 1,000%, i.e. it wasn't on the map in 2006, and it's growing the fastest amongst all universities. It's starting from a small base, so that helps. But the fact is, you've got already proven track record in landing big projects, right? I can name 3 very easily. Abundant Intelligences, amazing project, incredible. It's rocket science linked to Indigenous communities around the world and bringing AI into focus in a way that it wouldn't come into focus otherwise, right? You've got Next Generation Cities, which is an incredible environmental effort, which wants to land on the ground. It has a massive translational dimension. It's not just about discovery. They really want to change. They want to develop green cities. And Voltage, right? Huge electrification project, $127 million partnership. So to me, ambition's a great thing. CFREFs, NEFREFs, Canadian Research Excellence, right? Where there's proposals going forward. Those are things that one should be really trying to land. Canada Research Chairs as well. We've just changed at the Senate on Friday, criteria of eligibility, which includes now existing Concordia staff being eligible for our Canada Research Chairs. So we retain some of the good people rather than having them be poached and taken elsewhere. So there's opportunities on that front. Infrastructure. Looking at 2 things on infrastructure. One is looking at what we can do with Canada Foundation for Innovation, CFI, but also what we can do by being smart. So I don't know if Alyssa's here. She's doing amazing stuff. And she asked me to say this. No, just joking. But she's got a partnership where her area of synthetic biology, if I get this right, is complemented by a great genomics group at McGill and a third group, right? So she and the team are able to do work that they wouldn't be able to do within the confines of Concordia alone. So thinking about smart partnerships so that you can leverage the ecosystem, I think is another opportunity. Fourth is bringing in, where appropriate, non-traditional financiers. And I look at what's happening in aerospace now. They've got a massive innovation zone under development with all sorts of private sector partners, right? The health space is growing very rapidly, right? Public finance is huge. So Santé Québec might get a huge efficiency gain by contracting with our Applied AI Institute. Those guys already have 4 contracts with the provincial government in transport and 3 other areas. They could say to Santé Québec, what are your top 3 information challenges? And then go to work with them to actually deliver value. So those are some of the things that's a little bit more applied, but Concordia is strong on application, right? So I think if people are willing to pay for it, there's all sorts of knowledge and know-how that you can write up, which has huge value. So a few thoughts on trying to promote research in tough times.
There's a question in the back. Is that, so we'll come back to you. So we'll take the question on Zoom. Yes.
Yeah, so there's a question on Zoom. It's asking about a role for traditional medicine. Methods like naturopathy, yoga, meditation. So it's basically, contextualizing this within the School of Health. I think given that, the focus seems to be on modern medicine. So just asking if you could comment on that.
Yeah. So I think, I could get into a long discussion about the distinction between traditional and modern medicine, because so much of so-called modern medicine is derived from plants and other things that are found often in what are thought to be traditional approaches to things. Number one. Number two, I think understanding context and what people use and as their systems for thinking about and acting on health are really important. But I think it's also important to say that we have tools to understand value associated with anything we do. And we shouldn't be afraid to use those tools in any setting appropriately. And I think there are also important things there related to fairness and intellectual property that need to be respected so that you don't take away traditional therapies because they become commercialized and unaffordable. And so those would be a few thoughts on traditional. I wouldn't go just medicines. I think it's about traditional systems of thinking about health, and there are lots of them.
Sorry, I didn't mean to cut you off, Virginia. I'm Kristen Denfield. I am also from the Department of Psychology. I study children's social emotional development, but relevant for this question is I'm the Associate Chair of Psychology. And I'm picking up on Natalie's question because this talk's been really inspiring from a big picture, like, yeah, let's do all of this. And the things you just listed with CRCs and CFIs give us buildings and give us research capacity. But if we're thinking about this as sort of not being zero sum for departments, they come with teaching remissions. We get a building without the people in it. The growth at Concordia, I think, has resulted in constraints in the Office of Research, like just getting grants processed. And I was wondering if we could take a second to sort of think about those nitty gritties and like, does the School of Health have an allotment of course credits that we can use if one of our faculty members gets one of these great grants and is out of our teaching pool? And like, I guess I'm concerned that in this tight time, a lot of the funds we're looking for are going to help us with that research capacity without actually sort of providing the support the individuals need to do this on a day-to-day basis.
Mm-hmm. So I think you're raising a whole set of issues that are hard to get to in a talk like this, especially sort of one which is looking directionally at what the niche of the school is. But the devil is in the details when you want to operationalize. And it's a tough time, right? So that's not a surprise to anyone. And so there's no, this is not thought about with sort of rose-colored glasses or on, but rather, if you're going to do something, sometimes crisis can be helpful. And there may be more willingness to look at how traditional workflows are managed in a setting where actually that traditional workflow is not solvent, right? So what are the opportunities to do that? So there may be efficiencies that we can create. And that's in part, I mentioned indirectly in the talk, but more explicitly an education development unit. That would be a real opportunity to change the way that you can get to new curriculum faster, but not only faster, but maybe teach in a different way. Okay, because why is it that we're teaching exactly the same way we taught 30 years ago in some settings. I'm sure there's been evolution, but in many respects, the idea that you've got your 2 courses a semester that you have to teach, 3 credits, you have to show up every day, blah, 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 blah. It may be that you can change that work relationship with the teaching in such a way that it's much less of a burden on the professor's time and actually more enriching for the students, right? And I hold that out not because it's a pipe dream, but because I've seen it happen in various settings where we had no faculty at all, or almost no faculty, right? So to me, you can be resourceful in resource-constrained settings. Place I worked in Bangladesh, there's no reason they should have had a school of public health. They had one of the best schools of public health, according to the World Health Organization, in the world, with no resource, right? So I'm a big believer that in frugal innovation. Having said that, we need to look to mobilize resources around the school and not simply say, well, the school is going to be sort of within the university and it's just going to be there in the current resource scenario. No. Paul knows, Paul is head and the vice president for advancement. Absolutely critical that we get out there and we get some core resources for the school that are going to help facilitate some of these agendas in a significant way, right? So there's already been a little bit of movement on that front, but clearly that's a big priority for the university and that will help, right? You get the engine started. And then with new education programs where there's real demand from second career students who don't need loans, who don't need the tuition fees paid for by the government, but they get a tuition tax rebate if they pay. Those could be revenue generators, which have a benefit because the revenue is generated through the faculties, right? And this again is a strength of the virtual school. We're not talking about creating 10 floors on top of the Perform Center, which is the siloed school of health. No, it's a university-wide opportunity. So those would be some of the ways. And I wouldn't want, I see this as a start of a conversation. I know it's already been started, but I think getting into some of those nitty-gritty are critical in the next steps and thinking about how to translate some of this so that we can move forward in some discrete areas is absolutely critical.
There's a question in the back.
Yeah, so there's another maybe comment question. Thanking you for the presentation and welcome you to Concordia. But also asking about how does this sort of new and disconcerting drift we see against science, which we're seeing, of course, highly prevalent in the US, how is this going to figure in the challenges ahead?
Yeah, it's a tough time, and I would, I don't think I would have ever, and I'm willing to say I don't think anybody could have predicted what we're seeing, and I think it's going to continue to be very tough, at least until the midterm elections in the States. There may be some greater sanity that comes into the system, but I think the issue of distrust in science, distrust in public health, distrust in medicine is widespread. And it links also to a distrust in the ivory tower. And I think it's really important for us who are in the ivory tower and universities to recognize that the public does not necessarily think we're value added. And so I think it's really important. There's some very interesting, things that have come out recently. Michael Sandel's Tyranny of Merit. If you haven't read it, it's a great one. Or David Brooks' piece in the Atlantic on how the Ivy League broke America, in which elitism and exclusivity in education is not going to help, especially publicly funded universities in the future. I think Concordia is on the right edge of that from what I've seen. Next generation, it's got good accessibility and it's got good engagement with communities. But I think you've got to do more. You've got, and this is why I think partnering with real institutions that are doing things. I was on a call with the FRQ, la Fédération de Recherche du Québec, and the head, Rémi Quéron, he said, our budget is fixed and flat for the next 3 years. At least he's got a budget, okay? He said, the problem is the government wants us to do research that's going to make a difference to the things they care about. And he said, okay, what's that? And he said, well, I can tell you what it's not. He said, they don't think putting money into way upstream research into whatever is going to help Santé Québec. They want research which is going to show how frontline services can be preserved, how information systems can work better, and how you can do more with less. Okay? That's the political message coming to him, right? So where are the universities? That's why I mentioned the Applied AI Institute. If they went and got a contract with Santé Québec, right? All of a sudden the government says, actually Concordia moved, right? We've got a great thing. On the Voltage project, we have great relationships with Shawinigan, right? We just created this fantastic relationship with Hydro-Québec, whereby we can use their facilities. We don't pay for any of the infrastructure. So this is a translation where we get access to top-notch infrastructure at zero cost, CapEx or recurrent to the university. Paul knows that if we had tried to add a floor onto one of these buildings with that laboratory capacity, it would take 10 years and it would cost $100 million, right? So some of those being really practical with key partners who are already out there will give, I think, a lot more credibility to the institution not being off on its own, and it will help to build that trust.
Thank you. Yes. Yes, just come to the mic, please. Yes.
Hi, thanks for sharing your thoughts. My name is Andrew. I'm an entrepreneur from Nedge Biotechnologies, incubated at D3. I was just wondering if you have any thoughts on partnerships between entrepreneurs and entrepreneurial projects like ours with academia. And I'm just thinking about, as other people have mentioned, funding opportunities. For example, I was thinking about D2R at McGill, like DNA to RNA and RNA therapeutics funding opportunities that links partnerships, like private partnerships with academia. Do you have any thoughts you could share with us on that front?
Yeah, well, I think there are two dimensions of entrepreneurship that I think are really critical. First is making sure Concordia is fostering entrepreneurial competencies in researchers. And when I say entrepreneurial, it's not just a startup. It could be somebody who wants to do something in the social entrepreneurship space, or it could be somebody who wants to be intrapreneurial and change the behavior of a government, right? So one, that we are clear that we're facilitating that ability to navigate and negotiate change. The second is that we're entrepreneurial with our partners, right? And that's, I think, a little bit where D to R is, DNA to RNA. And their research vice presidency, Martha Crago, was very good, not only Martha, but others, in saying, how do we get the private sector to work with us on this? So those, I think, are good opportunities to explore. And I know in our VPRI, I'm looking to some of the folks in the, we're trying to, David Nguyen there is in charge of commercialization and making sure you know how to manage intellectual property and interact. So there's some real tangible things that are important in learning how to walk and work with some of these other partners, but there's absolutely critical to encourage And also, if you have ideas,
Mhm. Mhm.
we should hear them,
Mhm.
right?
Absolutely.
Because D to R didn't come from on top, came from down below. Lots of good ideas on that front. That's right. Well, it depends how you do the accounting, but yeah, it's somewhere around that. Yeah, it's a big number. And now they have the challenge of spending it. Right. And they've got that's sometimes a bit of an albatross. So you have to be careful about what you wish for, but it's a good position to be in.
So I'm mindful of time. It's, I'm told we're a bit past 4. I saw 2 more hands. Are
Right.
we
Why
up
don't we
for
take
2
those
more
questions?
questions? And then we'll move on the other side. There are refreshments and some snacks too. All right, Virginia.
So thank you very much. I'm Virginia Penhune. I'm also in the Department of Psychology, so we're activists.
Good.
So thank you for coming and for being open and laying out your ideas. I think this idea of teaching, I'm not going to remember the right term, but these like additional skills or whatever, and potentially teaching them to people who are coming back to school. I think that's a super interesting idea. But I wondered if you've really thought about what do you think those people are looking for and what do we have that we're going to teach them, right? Because I think one of the things that is a real challenge is that where the courses are going to come from is us, right? They're not going to be hired. We're not hiring. And we can develop a course, but as Kristen was pointing to, we need a human to deliver it. So what are the kinds of ideas based on the curriculum that we've already got, the people that are already here, that you see people wanting to take, and how could we develop that?
Okay. Do you want to take my question first? Okay. Okay, great question. So first of all, this gets back to one of your colleagues' earlier questions about the nitty-gritty. We're not in a position right now where business as usual is going to sustain the university. It just isn't, right? Where our revenues don't keep up with our costs at the moment. And it's not a small difference, it's huge. And so we need to really think about doing business differently. And as I said earlier, that may change the way in which we think about the resource ratio between professors, full-time faculty, and teaching. Right? And maybe it's too heavy, and there may be ways that one can change it. I've been involved in the development of programs where we had no full-time faculty, and where it's facilitated by adjunct faculty. Well, depending on the way you're financing the program, right? So, that's a program when you're talking about second career learners, you're not asking the government for money. It's a privately funded program, and the revenues from the program can provide stipends to adjunct faculty who come. There are lots of models on that front. And I'm not saying that's what everything will be done by, but there may be other ways of perhaps organizing programs that are existing, which give students actually a better education because there are 3 or 4 faculty who've come together to provide something which has a different title, but brings a broader set of competencies and has less onerous duties on each of the faculty relative to the courses they've been teaching for a long time, right? So those sorts of, I'm putting that out hypothetically, not that I have any grand plan, but I think those are the sorts of things that are incumbent upon the institution right now to start to think about, because the model that we've had is not sustainable as it's defined. So I don't have the solution. I have some ideas, but it's important that others think about what might make sense, who have obviously much more institutional memory than I do.
Yes. All right. So we'll take one last question. Yeah.
Thank you. Thanks both of you for today. I'm Rebecca Duclos. I'm the professor in art history department, but I'm also the former dean of the Faculty of Fine Arts. And I'll segue into the social hour with my question. First, it's a comment in saying that our Faculty of Fine Arts is a very curious and very collaborative group. And when I was dean, there were many occasions where many of my colleagues in this room welcomed us into their laboratories. We had a whole embedded faculty initiative that we were working on. We worked with Fourth Space with either lab walks, or sometimes I think they're called a closer look, where they're virtual lab visits. So we believe very much in fabricatory knowledge and collaboration. But Concordia is the size of a small town, and I'm really interested in how the School of Health can continue to play an even greater role in bringing us together. I mean, these conversations that were in their infancy, the curiosity that was just being piqued. There's so much more that we can do, but we actually just need to meet each other.
Yes,
And
yes.
so I'd love to hear what you might have to say about that. Thank you.
First of all, thanks for your question. Thanks for letting me know a little bit more about things I didn't know anything about in terms of things that you've already done. And the little I know about FOFA and the Creative Arts Therapy Program, just as an example, is really, really impressive. And my suggestion on how do you create, we talked about collaborative space as one of the critical things in that convergence science, because sometimes it's through the convergence that you get these ideas that you would never have thought of, or it just opens new vistas for interesting work. So thinking about how to systematically support that is important. There's some of the research institutes that have been up and running for a while, have a good experience on that, Milieu, I think being one of them. But also looking and understanding at some of the range of things and say, okay, well, how can we build on that experience rather than let it be just a function of a certain point in time where there are people who had a lot of energy for it who maybe don't have the same amount of energy for it anymore, right? So institutionalizing that without killing it, right? And I think that's where, again, there's a good track record of things where things D3 has great convergence capacity that I've seen. You mentioned some others. So there's the Center for Learning and CLSP. Is it CSLP? Sorry. Yes, Center for Learning and Performance. That's another great, I think, convergence opportunity, right? So one, being more aware. Sometimes when I discover these, I'm discovering them because I'm walking around the university, hanging out here, but I wonder sometimes whether faculty who've been here for a long time really know about them, because it's hard for them to get out of their, I know this personally, it's hard to get out of your department or wherever you might be. So I think making sure people are aware of them, but also supporting them in such a way, not status quo, but encouraging leadership to think about what does this next generation of this look like.
Thank you very much. And on that note, I'll piggyback a little bit off of that last comment just to say, so first of all, thank you. Thank you for the presentation and thank you for the questions, because the how is really what we are talking and concerned with on a pretty much daily basis. So we're really taking note of the questions and the comments today. They're really helpful. And maybe just to say as well, as of this morning, we now have 73 of you faculty members that are member of School of Health in the Concordia University Researcher category. So that's within about a month and a half or so of the membership being launched. And so part of the how we bring everyone together is through connect events or a colloquium series, our annual conference, et cetera. So we are really consciously working on creating some of these opportunities. We also had a call for research proposals that was actually finishing today. We've got a call for student awards that is out now. So just keep up. If you're not sure, just we have a website, but you can also reach out. We'll make sure you stay up to date. And of course, signing up to be a member of the School of Health really guarantees that you'll stay aware of everything. So again, thank you so much. Thank you, Dr. Evans.
Thank you.
And there are refreshments and snacks on the other side that were, I'll just say a little hats off and thank you to our nutritionist, Oriana, for preparing these for us today.